correct way, right? So this is a very good example. Okay, don't do that. Very good example. So you need to break it. Okay, yeah. To make sure the décolleté, the neck will come out. You see? You just do like that. Okay. Later when you do third massage, you just lower it. Okay. No big deal. You don't have to send your client back to the changing room and then change. You know what I mean? So now, okay, I'm ready. Okay. Yeah. So first of all, you're going to sanitize your hand, right? Before you start. She does not have any makeup on, but I'm going to simulate it, okay? Yeah, just in case your client has makeup, okay? So basically, we're going to use the round part, right? And if they have makeup, of course, we're going to put the massage cream on it, right? She doesn't have it, I'm just going to simulate it, okay? You put the massage cream with the spatula, and then you introduce your hand, right? Some mature client, you may need to use one finger, kind of like stretch the skin a little bit, okay? Some people, they do this way. I don't recommend it. It's a little bit too rough, right? Yeah. So you could just use one finger, just stretch tiny. Remove one side, and then the other side. If you have a lot of cleansing cream left over, remove. Very low, okay? Yeah. Throw it away, right? And now you're going to use the round part, okay? If they have eye makeup also. And same thing, you're going to put a little bit cleansing cream on it. One finger, stretch. So the eyeliner will come up, right? Downward, including eyeshadow, eyeliner, mascara, right? Back and forth a couple of times. And then underneath,
This will have the massage cream as well for the eyes.
yeah, if they do have eye makeup, okay. Yeah, she doesn't have anything, so I just simulated with the wet cotton pads, okay. Yeah. Of course, you need to change to another one if they do have makeup. Otherwise, you're gonna switch to the other side, right? Switch your hand. Same thing, down, downward. Until everything come over already, and then you clean underneath of the lashes. Cover the eye. You see that? You could clean the lashes one by one. Okay. I don't know how much eye makeup they're gonna have. Sometimes maybe one is not enough. You have to take another one. It could be possible. Okay. So now we're gonna do the face, right? So if your client they don't have makeup, but they will have maybe a little bit BB cream, CC cream, sunscreen, tinted sunscreen, or moisturizer, right? So definitely we have to do the cleanse, the superficial cleanse. So we're going to take a little bit under. This much is enough. Okay. Introduce your hand, right? First of all, you're going to apply on both sides of the neck, chin, cheek, nose, and then the forehead. Now you're going to apply the cleanser with your round. You go including a little bit of the décolleté too, okay? Chin to temple, and then the cheek.
I like watching this on a person.
Right? Yeah, it's better. Around the lips, right? Nose.
Do you feel like enough of her forehead is exposed with the headband?
Yes, but you know what I mean? You don't want too much hair to really bother you, okay? Yeah. You see, look, her hairline is right here.
Okay.
So you pull as much you can, but make sure there's no too much hair, you know. Because some clients they hate it because the hairline get very oily. That's it. Okay. This is just the application. Okay. Now I'm going to use one of the mitts, right? So first of all, we are going to use it to remove the cleanser first, and then analyze the skin, and then pick the toner, okay? To apply toner. So now this is just the water, mitts, or you could use round pad. You could use static wipes. You could use sponges. Just make sure remove the product. This movement, you see, look, you clean the cheek, side of the nose, eyebrow, also including the entire forehead. Don't you agree? So this movement actually clean the top of the face. So after the bridge of the nose, I'm done. Because do you need to do this? Not anymore, right? Because I already wiped it. Right? So you could just clean the bridge of the nose and done. If you want to double clean the eye, you could wipe the eye again, okay? Yeah. And then clean the front of the nose. That's it. Okay? But if you still see a lot of cleanser because you apply too much, you apply 1 cup of cleanser, then what are you going to do?
Double.
You need to flip over. But do you want to do that? Okay, you only have 1 hour, okay? You spend half of the time, 30 minutes, to cleanse your skin because you apply too much product, okay? Yeah. So try not to, okay? 1 time only. Now, what are you going to do? Skin analyzing first, okay? So you're going to apply the eye pop, okay? Of course, we're going to use the magnifying lamp, okay? Yeah, in afternoon to analyze the skin. This is the only machine we're going to use during the state board exam, okay? It's not like Sedesco or iPad. You have to demonstrating how to use high frequency, galvanic emission, ultrasonic emission, microcurrent, light therapy, okay? The examiner will pick the machine for you and you have to demonstrate it. When you demonstrate it, we're gonna ask you, what kind of machine is that? Oh, I'm using high frequency. What kind of current high frequency using? Alternating current. What is the contraindication? What is the benefit of the high frequency? And what kind of product you have to use during high frequency treatment. So they ask more detailed questions, but state board aesthetic license for New York, only magnifying. The other machine, only written exam, okay? Yeah. I found out in California and New Jersey, only written exam right now. They don't need to do any practical tests. I know, right? Yeah. After pandemic, they changed the visualization, you know. Maybe one day they're gonna go back, you know, I don't know, but until today, they don't have. So now we're gonna analyze the skin, okay? So everybody, hand your chart to the skin analyzing side, okay? So your client will let you know if they have any metal implant, diabetic, epilepsy, any skin condition, right? For example, like her, she has a scar here, but basically it's not gonna cause any contraindication because I don't use machine. It's just like a regular hydrogen facial. If they have filler injection, where like forehead, Botox, right? So basically you don't want to do aggressive massage, no machine there. Heart disease, blood pressure, high blood pressure, low blood pressure, right? Are they pregnant? If they're pregnant, you have to check if they have retinol in it, no salicylic acid, right? Yeah. And also, of course, no machines. Did they use any retinol? Did they do any AHA, chemical peel? Right? Because you don't know. Every day, client may use over-the-counter retinol product. And then they thought the strength is very low, but some of them could be very high, 0.5%, sometimes 1% retinol. You could easily get it, okay? Yeah. So their skin is probably sensitized by using every day, right? All allergy, but my client don't have any contraindications, okay? Yeah. Now let's look at skin type, okay? So we already talked about, right? She has a combination skin, right? Combination skin, normal on the cheeks, slightly oily on the chin and nose, but she has a lot of dehydration on the forehead, okay? Yeah. Elasticity, what do you think?
Good.
Excellent. Excellent. Alright, you see that? That's about very well, right? Excellent, okay. Skin sensitivity overall, I do see little sensitivity around her nose and chin. Do you see the redness? I don't know if you can see. Yeah, on her chin especially, right? Yeah. And also, on her chin, when I touch it, actually more warm than the cheeks too, okay? Because she has one information right here.
Oh, so they have surgery on her cheeks.
I see, okay. So, this is the reason why maybe she's a little bit more sensitive on that area, okay, yeah. Skin moisture level, okay. I want to set, they have three choices for you, right? Low, average, and high. Which one you gonna pick? Average, because she only has some dehydration on her forehead. Her cheek is quite normal though, okay? Her decollete neck also, okay, yeah, average, but just particular on her forehead, okay, yeah. Now lines, okay? She's young, she doesn't have any expression line, wrinkles, okay, yeah. Fine line as well, maybe just a little bit finer on her forehead, okay, due to the dehydration. Now look, zone 1 first, okay? Over zone 1, okay? I do see some sun damage, okay, yeah, and also dehydration. So on the dehydration, do you see dehydration there? Okay, so I'm gonna put the zone 1, okay, and then also hyperpigmentation, right? Zone 1 as well, okay, yeah. So I'm gonna put number 1 there, dehydration and pigmentations, okay. Texture very smooth, okay. Going down her nose, okay. She does have a little bit sebaceous filament on the nose, okay. Couple open comedone on the center of the bridge of the nose. So the comedone area, I'm gonna put the zone 2. Yes, Miss Simona.
Good morning.
Good
Sorry
morning.
to interrupt.
Yeah, no problem.
When did you last post for the
Uh,
photograph? Which one is?
Yeah, what to do? Elias, what to do?
I put out the way.
Ah.
1, 2, 3, 4. 1, 2, 3.
Yeah. Sometimes it's 1, 2, 3, 4. Yeah.
Thank you.
Oh, you're welcome.
Thank you.
So that is comedones, right, on her nose, okay? She does not have any hyperpigmentation. Some people may have little sun damage as well, right? Yeah. Now going to her chin, which is zone 3, she has one pupil, okay? It's coming up. So on the pupil area, I will put the zone 3. You see that? 1, 2, 3, okay? Zone 3 is the pupil, okay? Yeah. Then zone 4. Where is the zone 4? Eye area, okay, eye area, okay, yeah. Zone 4 is eye area, okay. So the eye area you're looking for either sun damage, dark circle, puffness, or fine lines, right? Yeah. Or sometimes milia, don't you agree? A lot of people, they have milia on the eye area, okay. Actually, I have one developing. I'm looking for a day, maybe I'm gonna extract, but you need to take maybe, couple days no makeup because you have open skin. She doesn't have milia, okay, yeah. Just a little sun damage, okay, yeah, especially on this side. We call solar litigo. She has one solar litigo right here, okay, yeah. Right here, okay, yeah. So in the future, I will recommending her to have the brightening facial using vitamin C corticosteroids, niacinamide to brighten the skin, okay? Or I can sell her a vitamin C serum or Vibra serum to brighten the skin every single night, okay? Yeah. And then zone 5, where is zone 5? The cheek. So you're gonna turn the face to the side, okay? Yeah. We don't know if she has good elasticity, but what else you're gonna see? She does not have a dehydration, but she does have some redness, sensitivity, and also pigmentation issues as well, okay? This type of pigmentation we call PIE. She has PIH here, but PIE means, anybody? Post-inflammatory erythema. Okay, there's 2 different kinds of discoloration. One is PIH. Usually happens on more darker skin tone, like Fitzpatrick 4, 5, 6, okay? After the breakout, right, you will have a brown spot, dark spot left over. But light skin tone, type 1, 2, 3, right? After you break out, the skin heals, but you have a red mark, which is erythema of the skin, redness of the skin, okay? So we call PIE, P-I-E, erythema of the skin, okay? Yeah.
Can you say one more time what it stands for?
Oh, post, P is post. I means inflammatory, okay, after inflammation. So H means hyperpigmentation. E means erythema. So PIH, dark spot. PIE, red spot, red marks, erythema of the skin, redness of the skin. Remember the medical term for redness? Erythema, okay? Yeah. Now, let me ask you, which one is more easy to get rid of it? PIE or PIH?
PIE.
PIE, yeah, because redness of the skin, more easy to get rid of it, okay? But dark pigmentation, dark spot, more harder, okay? More harder. So she does have a little bit PIE on the cheek on this side. Let's see this side of the face. Also has some PIE as well, okay? And this is a scar, she already talked about it, so basically no contraindication for today, okay? Yeah. Her zone 6, okay? She has a beautiful neck and décolleté area, okay? No pigmentation, no dehydrations, okay? Yeah. But sometimes people may have breakout continue on the chin to the neck to the décolleté too, right? Yeah. So we have to analyze 6 zone, okay? Yeah, 6 zone. So Melia, she doesn't have it. I'm gonna put NA. She has pustule? No. She only has pupille, yeah. So NA. Cuprous rosacea. She does have a little bit redness on the cheek, but I don't think she has cuprous yet. She's just like PIE, you know, right? Hyperpigmentation, yes. Okay, so mostly is on her zone 3, zone 5, zone 1. Okay, yeah. No hypo, which is white spot, right? Yeah. Dehydration, zone 1. Okay. Nevus mole, she doesn't have one on her cheeks. This side of the cheek, okay? We're not gonna do waxing, otherwise you have to skip that area. Okay. Skin tag, mostly some people maybe around the eye, or could be on the neck. Okay, she doesn't have. Okay, on her neck.
I have a question. So, for clients that do have like a lot of skin tags on their neck or should we avoid those or like is it okay?
No problem, okay? No, it's not contraindication for regular facial, but if you do waxing, right? Or you do dermaplaning. Ouch.
Use the
Exactly.
same.
Yeah.
So you can use the same products.
Yeah. Only contraindicated if you do waxing, dermaplaning, because you are not, using the blade to raise the skin, you know. So you have to avoid that area. And also when you do microdermabrasion, diamond dermabrasion, hydrodermabrasion, why? The section. Okay? If you're working on the skin tag, sometimes could cause irritation as well. Because the microdermabrasion, they scrape the crystal and they use the section, they use the crystal back and forth, okay? Also may have accident like attached to the suction and then you rip it off, okay? Yeah. If you're using high intensity of the suction machine, it's like vacuum. When you vacuum the floor, think about it, how powerful it is, right? Yeah.
I have a question.
Okay. You don't have it, don't worry. I scare her.
Sorry, I talk so much.
No, don't worry, yeah.
For like men, especially with beard, and we need to check zone 3, right? Like, do we have to like dig into their hair?
Okay, so for men, gentlemen, it's different. If they shaved, right, then regular. You could analyze skin everywhere because you see if they have ingrown hairs, right? If they have any hyperpigmentation, if they have any breakouts, okay, yeah. But if they have a beard this long, basically, are you going to analyze him like this? When you see what's going on there, right? It could be, maybe they have some skin condition there, but most of the time, it's very hard, especially the beard is this long, okay? I wish I have a model, like once in a while I will have student in a class, I can demonstrate it, okay? Yeah. Maybe I'm gonna ask the makeup teacher one. Tim, you know him too? Yeah, because you're in the. Oh yeah. You're in the beauty, makeup industry like for a long time. So those people you all know, right? Brandon?
I don't know Brendan.
Really? Okay, Brandon also. Tim, he loves to have facial. Let me ask him if one day he has time, free time, he can be my model. Okay, yeah. So here's beard from here to here. Wow. So actually, I love it. I actually don't like to do facial on people just shaved or shaved like the day before the facial, a little bit growing. You feel like there is exfoliating your hair. You feel like my poor hair.
Spiky.
Sometimes you feel like you're cutting your skin. Some of them, okay, like very coarse, stubborn hairs, okay. Yeah. So actually, I prefer a little bit longer, you know. So you could easily. Sometimes I use the cotton. If the beard is this long, I use the cotton just rubbing it. I'm able to get rid of the product if I accidentally apply the cleanser or any like other product there. Okay. Yeah. So it's not the issue actually. Okay. Yeah. Only the long hair maybe sometimes maybe a little issues. Okay? So for her today, I will just focus on the dehydration, okay, on her forehead, and then also remain the moisture level on her cheek because pretty much she has a nice condition on her cheek, no dehydration, right?
I think we're going on break soon.
Next, I'm going to give her the toning, right? So basically, I will use 5.5, okay,
if we take the
to
hour to do the
rebalance the skin pH. In the same time, 5.5, they also have the seaweed, which is RG extract. Give her the hydration because RG is very good humectant, right? So what is humectant? Attract water, right? Which is moisturizing agent, okay? So humectant is very good for dehydration or dry skin. So 5.5 actually not only have soothing agent, also has humectant added and then the seaweed extra as well. Okay, so I apply the toner, okay? So first of all, introduce everywhere, gently. Now you're going to gently tapping the neck. Go to the chin, to the temple. I usually do one time because I can spend more time for the rest of the steps. Cheeks, right? Chin to the yellow, one of the lip to the yellow. Then a laughing line underneath the cheekbone to the temple. Same thing on the other side. Temple. Of course, the forehead go to the other side, temple. And then forehead. Finish on the forehead, okay? So almost less than 1 minute, okay, for the tapping. Now molding. Lymphatic drainage like a glass slab, okay? Always inside towards outside. Now chin, little by little, lifting the skin to the temple. Finish? Go to the other side. You could change the shape of the shoe pile little by little, just using the tip, first use the whole shoe pile, right? Now chin to the yellow. Corner of the lip to the yellow as well. So everything we just do one time, okay? So you could finish the first massage very quick. Then we're gonna do laughing line underneath of the cheekbone to the temple. The other side. Under the cheekbone, lift it to the temple. Now, forehead. If you want to, you can use 2 hands. See that? Lifting the eyebrow towards to the forehead, little by little. You could give a little nice vibration. Go to the right side or left side. It's up to you. Back to the middle. Now I'm using the whole shoe pad, okay? Now the left side. Back to the middle again. Nice vibration and finish, okay? How do you feel?
Good.
Good, right? Now you can feel how it feels, right? So when you gave, you were like, okay, that's how it feels, okay? Yeah. So sometimes being a model, you learn a lot, okay? Yeah. So the shoe pad, we're gonna save it because we need to do money mask, okay? Now I'm going to do the double cleansing, right? So I'm gonna put the rest of the cleanser, okay, on my hand. Now, I don't need any more, so make sure you have enough cleanser or not too much cleanser, okay? When you practice, okay, you say last time I have a lot of cleanser left over, I didn't use it, I have to throw it away. It's wasting the product, right? So next time when you prepare the product, less product, okay? We are practicing, so sometimes it happens, okay? Because you take too much product, you didn't know how much you needed. So always do some adjustment, okay? Every time you do practice. Now, instead of massage cream, if you want to try, water, okay? Water, especially if you have breakout, you know, you don't have makeup, you don't want to use the heavy cleansing cream. Water mixed with cleanser, okay? So I'm gonna pour some water on my hand, mixed with stomach fluid. You could use it for Valhalla 1 or deep cleanser too, okay? Yeah. So I'm gonna pour some water on my hand.
For this step specifically, is it required that we use massage cream when we're doing the Staples exam?
Oh, okay. So her question is, what about for the stable test, okay? You're gonna bring a bottle, everything. Labeled it cleanser, toner, massage cream, treatment, mask, day and protection, okay? What is in it? I don't care as examiner. I don't care. I only check the label. Do you have that 5 things on the table, right? Inside of the bottle, you want to use real massage cream? Go ahead. You don't want it? You just put dermafluid. You could put a baby lotion inside. But you label massage cream, as long as you use that during the massage portion, you're fine, okay? Yeah. So you pick the product. You say, okay, I don't like the massage cream. Can I use something else? Then you put inside the bottle, label massage cream. That's all. Okay?
Does it matter how much product you're using while you're on the state board? Are they looking for the amount to see if it's the right amount?
Yes. Yeah. Not too much, not too little. Because some of the students, they try to take shortcut. They know that the less product they apply, the better, right? But sometimes the examiner knows, say, I don't see massage cream. Can you apply more? So you want to apply appropriate amount. Not too much, but not too little, okay? Yeah. So now we're gonna do the application, okay? So you go from the neck to the chin, around the lips, and then to the nose, right? You could also go from top, going down as well, okay? Some people also do this scissor too, you see? Instead of open, close their hand, they never open, close their hand. See that? See? Open, scissor to the chin, scissor to the lips, and come up. You know, instead of a 1, 2, 1, 2, you know what I mean? It's up to you, okay? There's many different kind of application you need to apply the product, okay? Now we're gonna start, right? First movement, Efferage, okay? Continue with friction.
Why am I talking? I should be sleeping.
Next, circle, right? You feel the movements, okay? So basically, the circle you could do like slow one or some fast,
In the order.
one
matters.
slow. Yeah. The order, it matters or not?
Or
During
friction.
the stable test, it's up to you. You could just do Efferage on the forehead. You know what I mean? You don't have to do 3 movements on the forehead. As long as you know what you're doing, what is the name of the movement, and how to perform, you know? So what is the name of this one? Fiction, you know? So if your examiner asks you what is the name of the movement you're doing, you just tell them. And this one? Supplement, you know? Also known as a percussion, okay? And this one? You could do that. You could do that, right? Yeah, so friction. It really doesn't matter which one you do. This one, Effleurage. You could call scissor effleurage. See that? Okay, now, what is that?
Friction.
That's friction, okay? So it's a scissor. You see that? You cannot just tell them I'm doing scissor because scissor can be effleurage. It can be friction too, right? And now this one, what is that? Friction, okay? Yeah. And this one?
Percussion.
Is the last one friction just because you're doing big circles?
Yeah, it doesn't really matter like smaller circle or big, large circle, but you are doing the rubbing movement, you know? Yeah. And this one? Effleurage, right? You could do a little bit pressure point too. And this one, petrissage, you could do it together, you could alternating, right? You could also do a little lymphatic drainage. Once you do the petrissage, you do lymphatic drainage to the earlobe too, you know? So it really doesn't matter while you do it. And this one is just pressure point massage, okay? If they ask you, okay, but you don't have to demonstrate pressure point massage. You could do it together. The pressure point, okay, make sure you do it nicely and gently, okay? Because I do have a student. Don't lifting your finger, okay? So continuously gliding your finger while you're doing the pressure point. Yes.
So we didn't really work with vibration.
Hmm.
How does vibration gonna be on the
Yeah.
so exactly how does
No, we don't have to demonstrating vibration during the stable, okay? But vibration, you just use the strength from your shoulder, create a vibration, okay? Yeah. You don't have to, but you have to know how, right? Now I'm gonna add water to my hand, okay? Yeah. After I add water, I will have more lubrication so I can do the rolling and tapping, okay? So instead of adding more cleanser, okay? Add water, okay? Now I'm gonna add more water. After the petrissage, we do scissors, right? So you add more water when you're doing the scissor on the chin, and then you're able to do the circular motion on the neck because you need a lubrication, right? The cleanser is almost drying. See, look. Do I need a more cleanser? Not at all, because you see, there's lots of a cleanser there. So you could do nice circular motion, cleaning the neck, the cheek, the chin, okay? Then you are going to do a tapping, okay? You could do 4 finger together or just 2 finger, okay? Lifting the chin area around the mandible, corner of the leg, on the resource muscle. And then the cheek, right? And then the cheek, chin, the other side of the chin. Now, what I'm doing?
Rolling.
Rolling. So rolling is type of a what massage movement? Percussion or tapping. So because you add more water, you see that? I have lots of lubrication now, even though I didn't use massage cream, so I still able to do fast rolling, you know, because the water gave me lots of lubrication. So I can continue cleanse that area and also give her a little bit lifting. Face lifting effect. Now I'm gonna go to the temple. Go to the forehead, right? We go to the other side of the temple. Lastly, finish with the effleurage. So give a little message to your client. This is it, no more massage. Okay. You You could finish here or finish on the collar especially if your client they have lash extensions, okay? Now again, let you feel the vibration. This is vibration. Or you could just finish here, vibration on the temple. Or rotating your finger on the temple, okay? And plus the temple. So this is a cleansing massage. Now, if you wear glove, you should remove your glove. If you didn't wear a glove, then you have to clean your hand very well. Get rid of the cleanser first, okay? So during the stable test, we're gonna check, do you take off your hand first before you clean your client? If you use, the hand right away after the massage because you have a cleanser or massage cream on your hand, you touch the toner bottle, tissue, cotton, we don't give you the infection control and kind of safety point. So you all have 1.6 point deduction. So after I clean my hand, then I'm going to clean my client. First of all, I'm going to use the piece of tissue, right? Make a triangle, and I'm going to apply, and I'm going to use it to pick up some product. Look, 60 to 80% are gone when you use the tissue. Okay? And if you want to, you could just patting on it, dab it on it. It's up to you, okay? You don't have to. But I usually like to do that because it really helped me to get rid of some product before I actually do the cleansing. So now I'm gonna take one of the mitts, right? Now what I'm gonna do, I'm gonna put the toner. Just put the toner in the middle, okay? And make sure not too wet. And make sure you have approximately the same thickness of it. Because you put toner, so you may feel a little bit kind of like cold, so you want to like introduce first. Now I'm going to go all over the neck to get rid of the product on the neck, and then chain to the earlobe. It really doesn't matter how many times you do it. It matters. Did you remove the product, right? Around the lips, okay. And then the nose, forehead, eyebrow, right? Cheekbone, side of the nose, forehead, eyebrow. Now, the bridge of the nose, couple of times, and finish on the temple, okay? And then this mitts, okay, I will recommend you guys to use twice, okay, because it has toner in it to help you to get rid of the cleanser or massage cream if you use the massage cream. For sensitive skin, try not to wipe so many times, okay? Do you recommend it? Because cotton, even though it's cotton, it also create frictions, So you want to wipe it more firmly, but not too many times. One time is enough, okay? One time is enough, you see? One time, enough. Because you already wipe off the product. Bridge of the nose, and that's it, okay? Maybe in front of the nose, I like to double clean both sides of the nose. It's usually, sometimes the product tends to get into the nose a little bit, right? Now I'm gonna take another mitt, this one, no toner. Okay, yes, exactly, just the water mitts, okay? Now I'm gonna double clean everywhere, okay? First introduce if you want to. Now if you want to, you could use the second technique, first the forehead, right? And no toner, then I can double clean her eye area, the cheekbone, the side of the nose, the bridge of the nose, around the lips, and also wipe the cheek, around the lips, wipe the cheeks, right? Chin, to the earlobe, neck, and finish either on the side of the neck or back of the ear. Okay? So this way, you never get bored, your client never get bored too. So you could use both technique alternating it, okay? Yeah. So, and then you, of course, you're gonna take a look. Do you have to flip over to do another time? I don't know, okay? To me, I don't have to do anymore because she's clean, okay? But if you still see shiny here, shiny there, there's product there and there, maybe you have to flip over and then clean it again, right? Yeah. So you take a look, you have to do that, okay? Yeah. Now, I already did the double cleansing. What is my next step? My next step? Exfoliation, yes, okay. So today I'm going to show you two different types of exfoliation, okay? I'm gonna use, so Sour Fresh, I'm gonna shake it.
Yes.
Sour Fresh, everybody know, right? What kind of exfoliation is for Sour Fresh?
Mechanical? I mean, chemical?
Chemical. Sour Fresh is acidic. It's based on AHA, alpha hydroxy acid, okay? Has 25% of lactic acid, which is very suitable for all skin type, okay? Yeah, especially for dry dehydrated skin, okay? And also has 2% mixture of malic acid from apple and totalic acid from the grapes. So it is AHA. There's no BHA in it, okay? Yeah. So alpha hydroxy acid chemical exfoliation, okay? So which means you don't have to do anything, you just apply, leave it there according to the manufacturer instruction. Some actually will be removing 2 minutes, 3 minutes,